Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Contraindications of intubation. The main contraindications of intubation are: 1. Laryngeal edema. In laryngeal edema, we cannot do uh, nasal intubation in the presence of laryngeal edema, because if there is the intubating tube, the endotracheal tube should pass through the larynx. So if there is edema, it is very difficult to pass through the larynx, so it is cannot be done. Then epiglottitis. In epiglottitis, there is infection of epiglottitis. If you do an intubation in the presence of epiglottitis, then the patient can develop the infection can spread to the inner structures. So we do not do epiglottitis in we do not do intubation in epiglottitis. Second, laryngotracheobronchitis. If the patient is suffering from laryngotracheobronchitis, even here this will actually precipitate the laryngospasm, so we do not do intubation. But all these are only relative contraindications. There are no absolute contraindications, because saving the person is the primary goal in intubation. Contraindications of intubation are laryngeal edema, epiglottitis, and laryngotracheobronchitis. Epiglottitis and laryngotracheobronchitis will precipitate laryngospasm. There is no absolute contraindication for intubation.
thank you and thank you for watching.